New South Wales health authorities are giving an update on the coronavirus outbreak. Let's listen in.
We're trying to understand the evidence base for that, and at this moment we still haven't changed our position that we think the coronavirus infection is infectious after symptom onset. But obviously, as this information is evolving, we will continue to adjust our public health response in accordance with that emerging evidence.
The woman who tested positive today, the close contacts, have you been in contact with them and how many?
Pleasingly, that patient was met at the airport, obviously acted on the advice provided to her to seek care, to advise about her overseas travel. And so for that patient, there is actually no close contacts. There are just a couple of very low-level contacts that we are currently tracing.
Are you able to provide information of any suburbs or areas in Sydney where these patients have visited before presenting to health authorities? And is there any risk to people who may be in those areas?
I would actually like to reassure the community that our public health unit staff have interviewed all the cases, and anyone who has their actions or the duration of time they've spent in certain environments have necessitated contact tracing. We have affected that. As you know, we've released the details of the flights and the community, and we will continue to release any information that is relevant to taking public health action. It is important that we don't create a sense that there is unsafeness in any of the suburbs where we may have a preponderance of the Chinese community. And we are monitoring some of the social media platforms, and I suppose we would like the media's assistance in really getting out messages around the facts. There are a lot of myths coming to bear in some of those social media platforms, and we would really urge people to go to trusted sources of truth, our website, and we are certainly wanting to strengthen our engagement with the Chinese media and other media platforms to get those messages out.
School is going back this week, and some independent schools, private schools, are actually emailing families and saying, if you've recently travelled to China, you can't come back to school unless you've been cleared by a doctor. Now, obviously, government schools aren't issuing that directive, and not all schools are. Do you think that's going too far?
So the national approach to this issue is that our advice is that people that have come back from, children that have come back from the Hubei province, so we have broadened it slightly from Wuhan with the emerging evidence of transmission in some of the adjacent areas from Wuhan, which is the city, to the Hubei province more broadly. We are recommending that if you have symptoms, that you should get immediately checked if you've come back from that area. And also, if you've been a contact of any confirmed case, that you should not attend school. Close contact with a confirmed case of novel coronavirus, you shouldn't attend school for the 14 days. Otherwise, we're just suggesting that people monitor their symptoms. So that's the advice we've sent out with schools. We've just had a national hookup, and there's been agreement that that is the approach nationally. And we will work with education departments in promulgating that consistent advice.
So you're not suggesting that any child that's travelled to China recently shouldn't go to school on Wednesday or whatever day they go back?
No, that's correct. The education department is transmitting that, and we've also released a media release which should be coming out shortly, which is confirming that advice.
Are the probable cases that are under observation all people that have travelled from China? And are you able to give a kind of age range of those people?
We were happy to provide that advice in terms of the age range. It's a varied age range. All of them would have come from China, and particularly consolidated in that Wuhan city and the Hubei province more broadly, all been a contact of a confirmed case. And as I indicated yesterday, of our 4 cases that we've got today, one did not go to Wuhan, but actually was a contact of a confirmed case in another province in China, who travelled to another province in China, and the other 3 were linked to travel to Wuhan.
And the condition of the other 3 people?
The condition is stable for the 3 individuals under care.
Can you explain to us the arrangements that are in place for the people who are in isolation, and what precautions are being taken for health workers to prevent the spread of the disease?
We have issued guidance around the type of infection control that healthcare workers have to wear. So there's particular requirements around wearing what's called a P2 or an N95 mask if you're providing care, if you're taking any swabs with the individual. There is guidance in relation to the principles of isolation, hand washing and the general hygiene measures that we would expect. Also, patients are given a surgical mask to minimise any risk of transmission. We also have a range of facilities, our isolation facilities across the state, so it's not all located at Westmead. And so all our hospitals have the ability, the majority of our hospitals have the ability to contain infectious patients. We do have measles cases, we do have TB. All of these are pathogens that are spread through the respiratory route where we do need high levels of containment.
A 21-year-old woman who, she presented herself. Can you just talk us through, you said that she followed good procedure. Like, what did she do? Did she ring ahead or, what? So
she travelled on the plane back in the direct flight from Sydney to Wuhan. She was met at the airport. She obviously received the fact sheet that said, if you become unwell, attend and seek care, and these are the signs and symptoms. She developed some symptoms about 24 hours later, and they worsened, presented to the emergency department. The emergency department took the appropriate procedures. The doctors wore the correct personal protective equipment when undertaking the testing. We were alerted, the testing was done, the patient was immediately put into isolation in a home isolation setting, and then once the diagnosis was confirmed, the patient has just been transported to Westmead Hospital.
Minister, NSW put out an information sheet. Some schools are doing the same. Do you have a message for parents with kids going back to school tomorrow?
Obviously, as Dr. Chant has just indicated, this is an evolving situation. The advice thus far has been that the period in which a person is infectious is once the symptoms have actually shown. So the message would be that children and university students generally would be quite safe in attending school and university, but it's about making sure that parents and, for that matter, older students are aware that if they do have any symptoms themselves, that they should not attend school or a university. I'd remind everybody that to this moment there has been no infection between humans in Australia. There's no evidence of that at this point. So each of these people who have actually been infected have actually had that occur in China. Or possibly on a flight from China, but certainly not in New South Wales. I think that's a fair comment, isn't it, Dr. Chant?
That's correct.
It's good to be right occasionally. So I don't see it as a health minister. I certainly am not saying to parents, to any parents, either just be aware, obviously, if you have a child who's a bit sick. The other thing is we should remember that China is actually in the middle of winter, and there's a lot of viruses in China at the moment. And there's a lot of other viruses that are not the coronavirus. So it's to be expected that we might have people who are visiting us or who have come home to New South Wales, to Australia, who have viruses, but not necessarily coronavirus. So the sensible thing is to perhaps treat it carefully and cautiously until we know. And certainly that's what's happened. I mean, the young lady that was just referred to, the 21-year-old, she kept herself in isolation. I think the message is getting out, and I've got to say thanks to the media. The media has been fantastic in getting that message out that if you're showing symptoms, then keep yourself in isolation, keep yourself away from other people, wear the mask if you've got one available, and make the contact. I think the reality is that you can now ring Health Direct, and I think the number is 1800 222 022. And you can get some advice, or you could ring ahead to your own GP or ring ahead to an emergency department and come forward to have the assistance. And I stress again, for any of our visitors from China or visitors who may have been, for that matter, in the Hubei province or for anywhere in China and have symptoms, Don't forget that the New South Wales government has ensured that when you visit our emergency departments, you won't, if you don't have travel insurance, you won't need it, because we're making sure that the tab will be picked up by the government, by the community. We are very concerned so that you feel comfortable in coming to our hospitals on a financial level and on a privacy level and on a medical level.